We have this wonderful young gentleman. He is interested in having a otoplasty procedure. It's a really favorite procedure of ours. It's very fulfilling for the patient, makes a big difference. What are you trying to accomplish here? What was your motivation? What are you trying to do?
I've always been a little bit self-conscious about my ears, you know. It's something that didn't bother me as much until about 4 years ago. I used to be quite a bit heavier set. I lost about 70 pounds. When I lost all that weight, my face got a lot thinner. So it's something that's definitely stuck out to me a lot more. For work, I have to wear a headset over my head. I actually have to be very particular about what type of a headset I buy, because if I get one that's too small, it will compress my ears and that hurts.
And
it's very uncomfortable.
And so just very briefly on the technical details of an otoplasty, there's two main components of an otoplasty. If you turn your head for a second just this way, you know, some folks, they are missing this, you know, this is called a helix. Some folks, they don't really have an anti-helix, and that's part of the reason why the ear is sort of folded forward. This gentleman actually has a pretty decent anti-helix, but this business here, this conchal, the conchal bowl, the cartilage that you sort of feel behind your ear, it's particularly large on this gentleman. When we do the procedure, we think the lion's share of this procedure is actually going to be working on the conchal bowl, and then the secondary thing will be this anti-helix. It's possible we won't have to touch the anti-helix at all. We'll make that determination as we do the procedure. It's now been 2 weeks since his bilateral otoplasty. I think a lot of our patients are curious, you know, looking at all kinds of procedures that we do, like what's the recovery going to be like? What will I look like, you know, sort of a week or two out? Tell us how you're feeling right now.
I feel great, no discomfort at all. Any discomfort that I had went away after about a week. The only significant discomfort was probably the first 2 days after the procedure itself. After that, I switched to Tylenol. Wasn't too bad. And then, like I said, after about a week, there was pretty much no discomfort. Like, I feel perfectly normal right now, 100%.
That's cool. It's interesting. We saw a facelift, the last facelift patient, the last patient yesterday was a facelift patient, and she said almost the exact same things. She said basically, you know, 1 to 2 days, about 2 days where, you know, you might feel as though you want to maybe take some Percocet.
Yeah.
Every now and again, we encounter a patient who doesn't take any Percocet for these procedures, but the majority, the first day or two. Then after that, there's a steep drop off, and people are feeling very comfortable.
10 days after the procedure, I was going out in public, you know, without a mask, you know, go outside. And I felt less self-conscious doing that 10 days after having surgery, where you can still see, you know, some swelling and bruising than I felt before, you know, when I would go out. Really happy that I decided to have the procedure done. I'm feeling really good about it.
Awesome.
Yep.
Okay, well, thanks for your attention.